Hello, everyone. Again, Greg Baker here in my series of conversations with founders that I find to be very fascinating, and hope you enjoy another conversation. Joined today with Mainul Mondal, founder and CEO of Ellipsis Health. Welcome.
Thank you. Great. Excited to be here and work with you.
Let's get started. And why don't you tell us a little bit about your background?
I am Bengali. I grew up in Bangladesh. At my high school there, I grew up in a family that has always believed in public service, that innovation is for the masses. And so really from the very get-go, sort of early training on what you want to build and how that impacts society. I ended up studying a bunch of things, anything from economics to CS, theater design. So it's an eclectic mix of subjects that I'm interested in.
Well, it usually creates a more well-rounded person. So
that's yet to happen, though, Greg.
Creates. I mean, it takes a while. I often wonder what I want to be when I grow up. So it's an ongoing exercise. So your current passion is Ellipsis Health. Why don't you explain a little bit about what we do, and then I'm sure you're running it in the background, and you can start to explain my problems.
Oh no, we're not running in the background. We would take permission and consent. But the story of Ellipsis Health on the mental health aspects really started. We started working on it mid 2017, based on past experiences. As I said, I grew up in Bangladesh and in a family that has a high level of depression, anxiety, and family members. My earliest memory of that is when I was really young, and I grew up taking my mom's blood pressure and other vitals because my dad was working a lot and my mom was going through some health issues. So my sister and I would do that regularly, and we would actually know what to do because it was measured in an objective way. Right, so we had all this workflow. If you find this is what you got to do. At the same time I was growing up, we started hearing the words depression and anxiety, right? And when I asked around, because I was a kid, what are these, right? Because I'm seeing this huge impact on our family, where my cousins were going through some hard times, and nobody could really explain it. So you could see this issue and the impact, but nobody had the structure of helping us understand what is it that one is going through. So fast forward now, I was sitting with my mom at her house, and she's on our case management calls, right? And these case managers, your primary care physicians, your nurses, who are there for you, amazing human beings, they're tasked to do impossible things. They're checking on your physical things, which they're instruments and tools. But when it comes to mental health, again, no objective measurements. You're giving self-reported questionnaires, either 8 questions, 9 questions for depression, you got 7 questions for anxiety, for the GAT-7, and you can basically chalk it up however you want to, right? So for my mom, who's had years of depression at a severity level, high severity level, if you ask how she's doing, she's like, I'm fine. And she's not fine. Right, and we all want to be there for someone like her, right? So when she's given this questionnaire, it's confusing to read through, and then if it's confusing to read through, and you're in some sort of denial, which is true in many cases, it is not going to objectively measure you, which means you're not going to get the care you deserve and need. Right? So Ellipsis started with this notion that Ellipsis Health is going to be the mental health co-pilot for every single clinical interaction. We're not a consumer tool. We're enterprise. We're working with sort of the really well-known names in healthcare to be the mental health co-pilot. So during a primary care physician call, nursing call, case management call, can we be the co-pilot to the assessments and triaging to the different care pathways?
Yeah, thinking back to most questionnaires, you kind of know the answer they want, so pretty easy to fake it. And another thing that you said, mothers are always fine to their children. There's never anything wrong in front of their children.
And they don't want to worry you, right?
Yeah.
They don't want to worry you, but then it creates this unhealthy cycle because then you're not able to take care of the person you love.
Well, and there's additionally there are people who don't have, they're living alone, and they're not talking to a lot of people, and no one's checking in on them. It's tough to detect what's going on with people.
Social interactions are super important, and so two things, right? So you have this aging population across the world, right? And they are lonely, right? Loneliness is a precursor for anxiety and depression, right? So how do you intervene early? Our kids, if you look at depression, anxiety, mental health issues start around 9-10 years of age. Greg, it takes 11 years from the time you show symptoms to getting care. 11 years. 11 years of someone's life, right?
And when you start at 9, if you're having issues that aren't being treated through your formative years, it has huge impacts for the rest of your life.
Absolutely. And if you think about the other aspect of this, literacy issues, right? America has one. May not be as significant as other countries, but we have one. But that doesn't mean that we can provide care. Everyone has a right to care, right? So for us, voice is something that most people use to communicate, and it has a lot of rich signals how we speak, what we say, to see what's happening in the brain, right? So imagine a world, if there's no reading per se, if you have reading issues, right, we still want to be there for you. We don't want this to be biased. It has to be for everyone. So it actually lowers the playing field so that everyone has access to a technology like this.
Now, does the tool require a baseline conversation, certain questions, or the first time I consent to it, it can pick up what's going on?
Yeah, we don't need a baseline, and we actually published if you think about healthcare and AI, it has to be unbiased, right? So one of the papers, I believe the second paper we published, is on a website that shows algorithm robustness across age, gender, ethnicities, right? How does this perform across all these groups? Because when you're in the job of providing care, you're providing care for everyone, right? So it has to be there for everyone. In this case, also, a psychiatrist or psychologist, a mental professional sees about 2,000 patients. These algorithms have already seen hundreds and hundreds of thousands of people, right? So by design, it's getting smarter and smarter in a clinically profound way.
Is there any HIPAA regulations or anything to track, not just for sharing, but if you're using my baseline, how does the software know to connect it to my next conversation?
Yeah. So, there are all these, first of all, everything needs to be done with permission and consent, right? It's just up to the individual to decide what kind of care they want. If you don't have permission and consent in place, we will not be working with an individual out of respect and the right thing to do. HIPAA is one of many rules. We're also GDPR compliant. We have privacy security laws in place as well, compliance in place as well, and then SOC 2 compliant as well, right? So for us, how do we connect back to sort of the EHR or case management software? We actually, if you think about sort of the macro world, I'll go a little bit higher. You have this voice revolution that's happening, right? Microsoft has a product called Nuance, and OpenAI is working with Nuance now. You have Google, you have Oracle, and Cerner. A lot of people are working on voice on the documentation and note taking, right? And we are an algorithm that can lie on that can be plugged in with an EHR. For example, if you think about telehealth visit, that's getting triggered from an EHR. We can play in the background, right, and be the smart engine to help a physician, provider, and whatnot. If you think about a case management software as well, you have Salesforce, you have Pegas of the world. We can do the same thing. So as soon as the visit starts, the permission and consent, everything has been in place, we can do the analysis and push it back to the EHR or the case management software to say, here's what we recommend that you do as a clinical decision support tool.
Great. Well, so you've started implementing recently, and how's it looking?
Good. We just in healthcare, and rightfully so in AI, you have to do multiple proof of concepts. So the team has done an amazing job on this proof of concepts. We're actually publishing some of the results. We are the best in the field of speech and mental health. We really understand what works, what doesn't work. We're very transparent. And the proof of concepts were very strong in what we perform, how we perform, that it's now going to start scaling with sort of the biggest names in healthcare. Because again, going back to my earlier comment about whether you're going through a primary care visit or for just regular checkup, or you're going through oncology visit because you're going through a really tough journey, we want to be there for you. So, and you think about perinatal as well, right? So we are now looking at scaling across multiple discipline on sort of virtual platforms. So we're really excited about it. I think that this kind of a technology with all the guardrails in place and looking at the robustness is going to have a massive impact on not just the assessment part, but the faster care pathways. And is really care working for mental health, right? That part as well.
What do you think we'll get the 11 years down to?
Look, I think that we can solve certain aspects of it. People who are willing to participate, people who are part of our clients and partners. I think we can, our algorithm performance is really high, and again, all published peer-reviewed publications. We can get to assessments in minutes. So if it's high within minutes and provider available, that can 11 years be a matter of days.
Yeah. Well, I think that, I probably don't get my blood work looked at often enough for my general health because it's kind of a pain to do. It hurts a little, but not too much, but it takes time and you have to set it up. And what you're offering is relatively painless. It's just, are you open to having the discussion?
Yeah, and it's actually not even just discussion. It's actually trained to work on a natural conversation and no questions being asked.
Well, you have to be to opt in. You have to be open to the
right.
So
Exactly.
I don't know if you've done 23andMe.
I have, yes.
So did you check the box to see if there were markers for certain types of cancer?
Yes, that's right.
Did you open that? I remember I signed up and said, yeah, I'll do that. And then when I got the email, they sent that one separately. And it's like, do I really want to click on this? So there's a little bit of that in what you're doing. But once you're to the point where where you would like to know if you should be getting help, it just becomes minutes.
Yeah, I mean, I think the two things. I think that it's really important to have a support network around you, right? To say, this is good care for you. This is what you need to do. And I think even if 5% of the population end up using a technology through systems that we work with, and we can impact the 5%, that's a big movement. The impact that you can have on the 5% of the population can be huge. And so, yeah, we hope to be, on every single encounter within a health system network. And if that happens, it will truly change the mental health operating system in the world.
Great. Well, and you obviously had some personal reasons for going after this, but looking at your career, this was not a straight path. What kind of other than the experiences with your mom, what kind of led you to start a company?
Look, I mean, I grew up in a family of entrepreneurs. I think a majority number of our family members are entrepreneurs, and they end up selecting hard problems to solve. Anywhere from
such as
one of my family members ended up doing power plants in Bangladesh when Bangladesh was just new and just upcoming. And that's that means you had to sort of dissect the problem of where Bangladesh was across many dimensions and where Bangladesh needed to be, right? My dad himself was an entrepreneur in sort of the textile space, which as you know, South Asia was one of the epicenters of innovation around textile and garments and whatnot. So I think that when you're growing up in that kind of environment, you're trained to say, you know what, you are going to work on a hard problem, right? Because that's going to impact masses of people. So I think a lot of that is sort of thank you to the family and upbringing, and we traveled to remote parts of Bangladesh and the world to learn about people. So I think that nothing in life is a straight journey, but it's about the problem that you're passionate about, that you want to solve, right? With no clear understanding or how that's going to be solved. But if you take on it, and in our case in mid 2017, no one was talking about AI and mental health and LLMs, any of that, right? So if no one was doing it, we said, you know what, we are going to do it because that's on you. And if you can do that, and I've got a high risk tolerance in terms of it's not knowing something about, I don't need to know everything. I want to sort of make a sort of commitment and say, you know what, we're going to solve this problem first. And we're recruiting an amazing team. If you look at it, Greg, the team we have are deeply people who care about this field and have got the pedigree to actually solve this problem.
And how did you bring them together? Was it just the idea, or did you have to actively recruit them? How was bringing the team together?
Yeah, I would say active recruit, the idea, the mission obviously helps, personal experiences, and lots of buying coffees for people. Early mornings, wherever they wanted to meet, I was there. So I think it's sort of the first few people kind of end up indicating what the next level set of people are going to recruit. So we went after sort of the best scientists in the clinician first, because this needed to be looked at from a vantage point of science and clinical first. Those fundamentals had to be correct. That will then trigger other aspects of ellipsis evolution. For example, our chief science officer, I met over 5 coffees in Menlo Park at 7 a.m, which is an hour and a half drive from me. I was there. She came from SRI and she was at Microsoft and other places, but she was a top scientist in speech, right? So a lot of convincing, mission, and then results.
Was there a certain aspect of each team member that you were looking for? When I did my startup, there was a question buried in the interviews that, depending on their answer, really meant what it was. That one was the key. Was there anything that you were really looking for in building your team?
Yeah, I think at the beginning of Ellipsis, what we look for are people who can build science and AI with credibility, right? Our values around ethics, AI, credibility, science, I wanted to make sure we build something on the right foundation, that those are never questioned. Right? We can stand on our own. We're an amazing clinical advisory board as well. So what I was looking for, and scientists and clinicians are not easy to work with, right? They have got this vision of, what's right, and sort of black or white. There's nothing gray. So I think we wanted to make sure that our science and clinical evidence was just black and white, right? Either it works or it doesn't work. So I think what I was looking for in the early days was, okay, we're going to stand on the foundation of valid science and clinical foundations. Well, I learned over the years, it was not easy, right? It wasn't easy because there's no playbook for this. At any level, we are creating the playbook of how do you look at this problem, how you try to solve it, and how do you get better. So that was a challenge. I think communicating effectively took years. It's still a work in progress. But I think that if you look at the team of Ellipsis, especially on the leadership team level, it has been more or less intact for 6 years, right?
Well, It's been an interesting 6 years. There are enough issues with doing a startup, but in the middle of it, we had a very disruptive event. Are you in an office setting, or were you dispersed anyway?
It was actually kind of perfect timing in terms of the office location wise. So our San Francisco shut down in March of 2020. Our office lease was coming to an end in May. So it was perfect timing for us in terms of office location. It was horrible, obviously, timing in terms of COVID and everything else. But we became all virtual. We're still very virtual as a company, and we have folks in the Bay Area, the East Coast, and Toronto, and Canada, and Poland. And for us, I think it is getting harder to build culture. It's harder to communicate online, virtually, and it's not as effective. So we're actually looking forward to bringing everyone back to the office on some fashion, sort of the right balance between working from home remotely to be in the office. But it was hard. That meant that we had to communicate what needed to be done more effectively. But I think that we could do a much better job in person.
How much did your team grow in 2020, 2021, where you were adding people that the rest of the team had never met in person?
Yeah, I think we were 16 to 18 people back in 2020, if I can remember correctly. And then, we're close to 50 now. So we've grown as a company. And a lot of the additions have been on the deep learning engineering side. So there's a concrete problem you can provide that they can solve. But I think that back to sort of the core of Ellipsis values, who we are, why we are who we are, those kind of sort of navigating through the value sort of cohesion, those need to be more in person. So it's getting harder and harder as the team expands.
Yeah, I've heard people say it's really tough to understand if the team is adopting the culture when you only know them from the shoulders up.
Oh yeah. So somebody said the other day, we were at an engineering retreat, he said, "Oh, you're actually taller than I thought." I'm like, "Oh, that's something like random and funny."
Yeah, it's been fun watching different teams do it different ways, and culture is very important as you're growing, and being able to maintain that as you add more people. We used to talk about the 2 pizza meeting. Once you got beyond 2 pizzas in the conference room for the entire company, it became a different animal.
And yeah, we have a town hall that happens every Tuesday. We have leadership meetings, and we have our one-on-ones. But leading through the last few years, even now, isn't easy. People are going through tough times across so many different areas of life, and so unpredictable in so many ways. So I think this is also where I'm learning how to over communicate, and I'm also actually seeing all the areas sort of I have massive amount of deficiency, and so it's really important that we get that feedback, especially now.
You're tackling a pretty big problem. You're passionate about it, but hopefully you do something besides work.
No, all I do is work. No,
okay.
I do. No. We have a family that enjoys comedy. It's I think, especially with all the cruelty in the world that we are seeing, and I think comedy is a little bit of the escape. I think I'm not a great runner at all, but I sort of hobble along. But we try to do a lot of things with the family, and lots of hike and so on and so forth.
Kids?
Yeah, 2. Anderson is about to be 13, and Cassidy is 18.
All right. So you're almost you've entered in the you're getting dumber period.
Oh, absolutely, and uncool.
It's really fun when they get out of when they start moving into their own place, and you start getting smarter again. I'll never forget the call from my daughter when she got her first apartment out of college and said, "Do you know how much cable costs?" Yeah, I'm vaguely familiar with that. I've been paying it all your life.
Exactly. You just didn't know about it.
And you've been borrowing it from me for the past 4 years while you've been in 5 years while you've been in school. So, yeah.
All the Netflix passwords and everything else.
Wait until you see your cell phone bill.
I thought it was free.
Well, if you're nice to your mom, it is. For my kids. What do you think you would have done if Ellipsis hadn't? What big problem would you be tackling? You have to compete with your siblings, so it wouldn't be something small.
Yeah. Well, I was also looking at the same time sort of an ag problem. I was also looking at how do you sort of predict crop yield much more accurately, and how it does impact. So I was looking at that and Ellipsis at the same time, and then just chose to go with Ellipsis. I'm obviously super excited and very glad that I chose Ellipsis, because I think that I think voice is a scalable platform, and I really wanted to sort of see scale of very hard problem to solve, because I'm drawn to solving hard problems, but also a problem that can scale massively, right? Language, spoken language, how do you communicate is the way to, for me, that was really interesting as it applied to sort of AI and mental health.
Great. Don't want to take up too much of your time. I'd rather you go solve lots of problems. Is there anything else you'd like to share before we wrap this up?
No, I think that, look, I mean, you've been an amazing supporter for Ellipsis and for me and for the team. And I think that in general for founders, starting a company and growing the company is not easy. It's extremely hard. So I think the more support and guidance and mentorship we get from funds is really important and critical, because in many ways founders are lonely, right? So I think that
you have no one to talk to in your there are certain things that are happening in Ellipsis that they're yours and
they're mine. Yeah.
Hopefully we can do more, but I always look at this, especially having started a company, I realize you do work. I'm just kind of here to help. It's an honor to know you and several other people in the portfolio. And I thank you for taking the time so people got to know you a little bit more and understand Ellipsis. Thanks a lot for your time.
Thanks, Greg. Thanks for the opportunity, and always here to connect with anyone.